Governor Hutchinson, can you hear me?
Can you all see me?
Not yet. There you are. Howdy.
How they must be able to see me. How can you get me to talk?
I see you now.
Can you all hear me now?
The weather is really bad up here, so I'm hoping we don't lose our connectivity.
We can hear you, Governor.
Are you?
Yeah.
All right. So I think everybody can hear me. Is that right? And so
Yes.
just let me know how we can start this program then.
First, I'd like to thank you, Governor Hutchinson, for agreeing to join these fabulous honor students who hail from honors colleges and programs throughout the state of Arkansas. And for those of you listening as guests and staff and faculty, if you could keep your camera and your mute off. The students, I'm going to go ahead and keep the camera on and the mute until we have our Q&A session. So I'm going to go ahead. I'm Linda Kuhn, Dean of the Honors College, and it's my great pleasure to welcome you all, kind of sadly, to our final installment of Pandemic. It's been an awesome class. You've been great students. And I'm going to introduce the governor of the state of Arkansas, Governor Asa Hutchinson, who leads the state with vast experience and expertise. He was first appointed by President Ronald Reagan as U.S. Attorney for the Western District of Arkansas in 1982. He later went on to win 3 successive terms in the U.S. House of Representatives, beginning in 1992. During his 3rd term in Congress, President George W. Bush appointed Governor Hutchinson as Director of the Drug Enforcement Administration and later as Undersecretary in the newly created Department of Homeland Security. Since elected as governor, the thing that for us in higher ed has been super impressive has been Asa Hutchinson's investment in K-12 education, which is the reason why we can have an awesome honors college, particularly in the terms of computer science and coding and working with students from K through 12 in these important subjects and trying to expand high-speed broadband upgrades in Arkansas. So Arkansas is a leader in many ways in education, certainly in the AP, but also in this coding drive. Governor Hutchinson's experience has established him as a national resource for his expertise on trade, energy, national security, and education. The governor has been invited to the White House several times, and in fact, I think he just had a governor's meeting with the president and the vice president. But he's been in lively discussions about healthcare, Medicaid, and educational issues. Governor Hutchinson grew up on a small farm in Gravette, and importantly, he is an alumnus of the University of Arkansas School of Law. Go Razorbacks. Now I'm going to turn it over to our distinguished visitor, Governor Asa Hutchinson, the 46th governor of the state of Arkansas.
Wow, well, that's a fantastic introduction. Thank you. And it's my privilege to be with you this morning. I do want to, I know y'all have got a lot of questions and you've been studying this for some time, so I don't want to spend too much time rehashing it, but do let me make a couple of points. First of all, we're right in the middle of the pandemic still, so it's not like we're over it and we're looking back in history and saying, what'd you do right, what'd you do wrong? We're still making judgments every day, and it's hard to predict the future on it. I was at the White House yesterday, and it was so fascinating talking to Dr. Birx, and she was explaining to me how when this is all over with, they're going to spend a lot of time studying the molecular, not history, but structure of the different viruses, and they'll be able to trace the virus in Arkansas as to where it originated. And like right now, she was pointing out that the virus in New York is different from the molecular structure from the virus in California, because the virus in California came from China, and the virus in New York came from Europe. Now, they might have ultimately all came from the same place, but they have a little bit different molecular structure, even though it's the same virus. And so they're going to be able to study this for a long time and really trace the flow of how this impacted every state in different ways. So I did go through the 9/11 event. Of course, I was in the Bush administration, and after the attack on America and how we responded to it, there was the 9/11 Commission, and that reviewed everything that was done, right and wrong, made a report to our nation, and that's what actually set up the new Department of Homeland Security. So when this is all over with, there's going to be a similar bipartisan, I hope, commission that's going to review and hear not just what the president has done, but what each governor has done, because the governors have, as the president has said, you know, it's really they're in charge of much in their states. You know, our approach to it in Arkansas has been first dealing with the virus itself on the virus control. We did not shelter in place in Arkansas. That judgment will remain to be seen as to whether that was the right judgment or not. At this point in time, I believe it was the right judgment and continues to be, because, you know, our numbers were under control, beating everybody. And the fact that some of our numbers are coming back now, I don't think you can attribute to a judgment that was made 2 months ago. But we concentrate on the virus control. And even with the spike that we've had in the last couple of days, we're still very low in terms of our hospitalization rate in Arkansas, in terms of our death rate in Arkansas, and our testing continues to increase. A second part of what we've done is the communication. As you know, I've been there every day, almost, giving a report to Arkansas, and it's become a little bit of a tradition in regular presentation. And I just adopted the philosophy, transparency, communicate the ups and downs on this. It helps people to make good decisions. And then it's the economic part of it and the rebuilding of our economy. And that's what people are really focusing on now, because the numbers will come out today that we went from a 3.5% unemployment rate before this started. Then last month it was 5%. This month our unemployment rate in Arkansas will be 10% with a little bit more decimal point there. So, you know, it hits us, and we want to get people to work, and it impacts people's lives, not just through the virus, but also through so many other socioeconomic challenges that they face. So with that, let me turn it over for questions you might have.
All right, can you all hear me? Great, thank you so much, Governor Hutchinson. I've got a whole slew of great questions from our honor scholars across the state, but I'm going to start with John Brown University Communication Honor student, Jerica Barkley, who actually has a question about your recent press briefing. So Jerica, could you ask your question, please?
Can you see and hear me?
I can hear you just fine. There you go, I can see you.
All right. Well, hello, Governor Hutchinson. Thank you so much again for coming and presenting. I just had a quick question about your most recent press briefing, in which I think it was Dr. Smith addressed a spike of recent cases. I think it's, you know, up to 450 now. And he said that, like, maybe half of those are already institutionalized and they just weren't accounted for in the system, and then the other half is probably a result of increased testing. But I was just wondering, considering this, how are you trying to accurately account for the increase and decrease in cases, and then, you know, how do you respond accurately to that?
Well, that's where the follow-up is so critical. And so when we see 450 cases in one day, we first look, where are they coming from? And so, you know, a certain batch of the cases came from Dardanelle area, where we know there's a cluster because of the poultry industry and a particular van that was transporting workers, and everybody in the van was positive. So there's a little cluster there because of that, and we identify that. We look at the rest of them, and they're really scattered around the state. and then you have a large bulk of them in the prison in Forest City. And so that's where we do our contact tracing and follow up, and that is the critical part of it. And we actually, whenever we have this increased number, that strains the resources to follow up with each person as to who they've been in contact with, how did they get this, do the research on it. So we're actually hiring more people now. Some of them are college graduates that will help us with that contact tracing. He's an epidemiologist, and he looks at all the data. He follows up very carefully, and that's how we control the spread. So even though we have an increased number, that in and of itself doesn't worry us as much as simply that we're find out where it's coming from, how you can address it, quarantine them, and keep it from spreading.
Well, thank you so much. I appreciate it.
Thank you for your question, Jerica. Our second question is from University of Arkansas philosophy major Grace Falkenberry, and she actually has a question about leadership. So ask your question, Grace.
Hi.
Hey, Grace.
I don't know if y'all can see me or hear me. But my question for you, Governor Hutchinson, is being the head of the state can never be easy. But what would you say is the hardest part about being a leader right now? And how do you just keep feeling, entirely overwhelmed in these really tumultuous times?
Very good question, and this is very tough. It's tough not just on me, but on my entire team. And they were talking about how tough it is on them. And part of it is the importance of it, the life and death decisions that are made. And part of it is the absolute routineness of it every day and the uncertainty as to when it's going to end. That is what makes this very unique. And, in the post 9/11 environment, when I was at Homeland Security, it was a very simple message also. And the message was, we're taking these steps to protect America from a terrorist attack. And everybody was very united on that. There's so many conflicting messages right now, both with the devastation to the economy, both with the concern health-wise, both with the constraints on our normal lives, from education to sports. And so there's so many different pressure points. And then also, we don't know a whole lot. You know how to kill a terrorist. You know how to do some of these things, but when it comes to the virus, we don't know very much about this virus still. CDC comes out with information that maybe it's not passable from the surface, and it's simply virally spread through person-to-person transmission. And so they're learning more. They're learning more about the danger and risk to children. And then the public's response has been different. Whenever I first started this, there was enormous national pressure. You've got to shelter in place. You've got to shelter in place. Why haven't you done that yet? And now the pressure is just the opposite. We've got to go back to work. There's riots in the streets. And so, it's a shifting mindset that's out there. And the longer this goes on, it can shift even again. So there's a lot of challenge there. How do I manage this as a leader? I really think the most important thing is that daily communication with the public, letting them see the ups and downs of it. Let them see, they know when you make a mistake. They know when you have success. They know their responsibility. And you're sharing the journey with them. And I think that's what leadership is about. Not hiding the ball, not acting like we know everything, but sharing the journey with them and helping guide and lead them through that. And you also lead by example. I mean, the first thing that I did whenever the CDC said it's a good idea to wear a mask, I'm a politician. I don't like having a bad look. Well, I got over that the first day. I just put on the mask, went out there. They took pictures of me. It was on the front page of the paper. But I wanted to set an example that, hey, this is important for us. So those are just a couple points as to how we're handling it.
Thank
Right.
you, sir.
Excellent question, Grace. Our next question is from John Brown University, major in worship arts, Garrett Seal, and he wants to get a sneak preview of the fall. So Garrett, would you ask your question?
Sure. Good morning, Governor. I'd just like to say thanks again for agreeing to meet with us. It really does mean a lot. I'm curious as to if we do see a resurgence in the fall, as some scholars are saying that we will, what direction are you planning on leading Arkansas? Is it going to be, different than the way we've handled it so far, or, could you speak a little bit to that?
It's a great question, and one there we're spending a lot of time on. And the answer is, yeah, we're going to handle it differently in the fall. And we actually expect it to come back to still be an issue there, and it will continue to be an issue until we get an immunization drug. And so I've urged our higher education and, the University of Arkansas Board of Trustees, other universities have by and large said we are going to go back to traditional classroom settings next fall. And what we're doing to prepare for that is we're trying to build the infrastructure, which is the testing capability on your campus or close to your campus. Did you say you're John Brown? Is that right?
Yes, sir.
Okay. So, this will be where every, even private institution and public institution can access some infrastructure we have for testing students quickly and a quick turnaround on it, so you know exactly where the issues are. If there's anything symptomatic, we're going to test more. And so there's going to be students in the university system that's going to be positive. We're not going to shut down the classes. We're not going to close the schools. We're going to isolate that student. We're going to do the contact tracing to see who else might have been exposed to it. And we're going to quarantine those as needed be. And then we're going to continue the educational atmosphere. It could be in the K through 12 that, it's going to be a larger outbreak in a school. So we might close it down for 2 or 3 days, do a deep cleaning of it, do more testing, do some online instruction, and then go back to classroom instruction. And so we've got to plow through it. And if there's one thing that I think is important is that we have to, and you can't necessarily manage the virus, I understand that, but you have to help control the virus in a way that you can also live, educate, and have somewhat of normalcy in day-to-day activities. And the key to all of that is doing your social distancing, protecting yourself and others, as well as the infrastructure of testing and contact tracing. That's the strategy for the fall, and that'll allow us to get back to at least a new normal.
Thank you.
Thank you, Garrett. Now I'm turning to the Walton College of Business at the University of Arkansas marketing major. Jonah Rappert has a very kind of a follow-up question about, it's more philosophical, about the balance between public safety and economic health. So Jonah, could you come up to the screen, please? Jonah. All right, well, I thought he was here. So I'm going to now turn to Neala Gotel from Northwest Arkansas Community College, who asked 2 great questions, but I think I'm going to have her ask the question about the Delta. So Neala.
Good morning, Governor. How are you?
Very well.
My question was about an April article in the Arkansas Democrat Gazette, which reported that Black Arkansans virus hit seen as disproportionate. Kevin Smith, the mayor of Helena, West Helena, is quoted as saying, many people in the Delta are reluctant to go to the doctor in part because of the cost. Many also don't have a computer or access to the internet where they could read about the symptoms of the coronavirus. What policies can be implemented to address the critical needs of communities like these instead of having them rely on Band-Aid solutions?
Well, of course, I've talked to Mayor Smith, and one of the things that we did was we sent the UAMS mobile testing lab over to Helena, West Helena to do a larger segment in terms of testing. We also have done, we've targeted some of our advertising to the minority communities so that we can make them aware of the testing availability, and we've made it free. And so, you know, any test is free to them, but we have to make sure that they're aware of that. And then it's really interesting that we had an outbreak in Forest City, which is about 50% minority, I believe. And so we wanted to do a lot of testing there, and we sent one group to go over and test, but the community did not want to be tested. They were reluctant to. And you know why? It wasn't the cost. It was because they were afraid of the quarantine, that they had to wait until the test came back, and they couldn't work during that time. So it was a job issue. So the next time we sent the testing in there, we said, we're going to get you the results quickly, and you don't have to quarantine until the tests come back. And so that made a difference. We had 550 want to be tested. So you've got to make some adjustments, you know, as to why there's an increased impact on the minority community. That includes also the Marshallese. I think part of it is some are more communal and social in their lifestyles, so that it's easier to spread in that community. And then secondly, obviously in some minorities you have some underlying health issues, and it could be related to the unavailability or access to health care. But that does have a cost impact in terms of the health consequences. So we're looking at all of those things, aware of them, and trying to address them.
Thank you, sir.
Thank you, Niala. Now I'm turning to biochemistry and Spanish major at the University of Arkansas, Mandeep Kaur. Mandeep, I really liked your question about faith-based organizations during a pandemic. So would you like to ask your question, please?
Hi, good morning. So yeah, my question was about faith-based organizations. In March in Claiborne County, about 32 out of 93 church attendees tested positive for COVID-19 after there's 2 symptomatic people. And from this, there was also 26 community spreads. And just to shows that like how a lot of Arkansas may be rural, but it doesn't require much for a community to become affected. With reopening, including faith-based organizations, as long as social distance is followed, of course, will the guidelines be enough to prevent the spread of the virus that is similar to Claiborne County? And how specifically will these measures make a difference?
Great question. And first of all, that a medical journal, Dr. Smith was very proud of this, actually studied Cleburne, I think it was Greer's Ferry city, the church in Cleburne County that had that outbreak. So there's been a lot of study about that. But, you know, one of the things we've done with our churches is, you know, I just come from the old school that we have a light approach with our churches. You know, and they've been great because we'll set guidelines for them. And for a while we said you should not be meeting in person as a result of this outbreak, and virtually all of them complied when they saw the seriousness of it for their congregations. And then we allowed them to open up, but they're still, my church is still not meeting because even though they can, they want to make sure that they're careful before they do it. And so we're working with them, and they're being very careful about it and thoughtful about it. How worried am I about additional outbreaks? Sure, I'm worried about it. But in the church environment, I mean, it's hard to have church without having fellowship, and fellowship means close contact in many instances. It's hard to do that social distancing, but the pastors I've talked to know completely how critical this is, and many of their congregation members are elderly, and so they don't want that to happen, and so they're being very careful. And I think there are ways that it can be done. They're very innovative and creative. And you know what we've also learned is some of these preachers are really good at online preaching. And I think you'll see that as part of the blended service opportunities, combining continued online with some in-person services.
Okay, thank you, Mandeep. I'd like to turn now to a question from Mallory McDonald about Lincoln, Arkansas.
Hi, Governor. Thank you so much for coming. I'm from Kansas, so I'm like watching Arkansas and trying to keep up with all you guys. And I have gone onto the COVID website, and I keep seeing like this big like gray area over at Lincoln County, Arkansas. And like researching it, there's like a lot of controversy, and we don't know how many cases are out there. So I just wanted to hear your opinion and what you know, and like, yeah, tell me about it, please.
Well, of course, Lincoln County, and tell me if I didn't get your question just right, because I had to tell them something here. But Lincoln County, of course, is where you have Cummins Prison. And so the spike in Lincoln County, of course, is largely from Cummins Prison. And even though we have a large number of cases there, they're not active cases. And so Lincoln County has gone way down in active cases because we did control it there in Cummins maximum security unit. And the prisoners, the inmates, have recovered from that and are going back into the normal operations. So that's a little bit better situation there. Obviously, we always worry about the community. So many of the staff at the prison go back and forth to the community. And that's what we worried about there in Lincoln County, but also in Forest City, because you have somebody who works in the prison environment that can be exposed, and they go home, they go to the grocery store, they go out in their community, and it can spread very quickly if it's not managed. So we're doing that in both those counties, but I think Lincoln County is in better shape today than it was, and those case numbers have gone down in terms of active cases.
Thank you.
Thank you, Mallory. I'm going to turn now to nursing major from the University of Arkansas, Margot Levitt, who has a question about long-term impacts for the state of Arkansas.
Good morning, Governor. Can you hear me?
I can hear you fine.
Fantastic. So I'm wondering what long-term consequences as a result of both the pandemic and our response to it that you anticipate in the state of Arkansas specifically, and if you anticipate those impacts disproportionately affecting minority and impoverished citizens.
Well, it's going to impact in a lot of ways. I mean, I think it's going to change education and the delivery of education, both at the university level and at K through 12. It's going to impact sports. So I think there'll be a lot of things that we change just because of what we've learned in the last 2 months. That remains to be seen, but I think we'll re-examine a lot of things. We've learned in state government, for example, you can really be efficient in some ways, even though you're working remotely. In terms of the impact on people, I do believe there is a disparity. I just came back from Washington, D.C. I've mentioned that 3 times now, but it leads to some stories that it's a ghost town. And in Washington, D.C., you've got all of the lobbyists, you've got a lot of the high-level thinking done in the high-tech industry, and they're all working remotely, and they can do it fine. They're continuing to produce, they're continuing to do their business, they're continuing to make a livelihood. But the streets are empty. I stayed at the Willard Hotel, and there are only 3 people staying in the whole hotel.
Wow.
That means hundreds of workers have been laid off. And these are not the high income, these are the low income service industry. So they are adversely impacted. Now, right now, and that's true in Arkansas too. And so it's a small business owner. It is a service individual. It is the lower income that is most quickly impacted. Now they're getting unemployment. They're also getting a boost. They're doing okay once they get the money flow to them. but that's going to end at some point. And I'm worried that this is some long-term structural damage and change that'll be harder for some of the lower income jobs to come back that are so critical to them. And I think there'll be some adverse consequences there that we've got to watch. I'm only going to have time for maybe one more question here. I love this. I know this is toward the end, but we're running a little bit more than and I got Dr. Smith on the line waiting for me. So maybe one question.
I totally understand. So let's have our last question from Arkansas State University at Mountain Home. And Maddie Gerke, it's a follow-up about a plan to recover unemployment rates. So Maddie, could you get up here?
Yes, my question was pretty vague. It was just, is there a plan in place to try and recover the unemployment rates dropping in Arkansas or rising in Arkansas? Just how to fix that once this virus is over.
Well, it's a very good question. And yes, there is a plan. And what I think we'll see in the coming months is that Arkansas's unemployment rate will be lower than the nation and many of our surrounding states. And in fact, I think the national unemployment is about 14%. Ours is 10%. Now, why is that? Partly because we didn't cause another 100,000 to be unemployed by sheltering in place. That would have put more unemployed out there. And it's also allowed us, I believe, to more quickly return to a normal economy. Now, we haven't been hit like New York and DC and Florida and some other states. So, there's some differences. I'm not pointing fingers saying, you did terrible, we did great. But because we didn't shelter in place, we've got a better economic opportunity than some other places. We also have a more diverse economy. So I think you'll see in the third and fourth quarter this year a fairly quick rebound, particularly in the fourth quarter. So I'm optimistic about that as we get back to business. I think we'll recover fairly quickly. Listen, y'all are terrific. Very proud of you. And I know I didn't get to everybody, so hopefully there'll be another occasion in the future. Professor.
Thank you so much, Governor. That was wonderful. Thank you to Allison Roberts for all your help. Really appreciate it. On behalf of Honors Arkansas, I know you're busy, so thank you very much.
Thank you.